morning. My name is Van Laskoski. I'm the Public Information Officer on the Emergency Management Team here at Stevens County Hospital, coming to you with our update on COVID-19, March 24th, 2020. We had some great conversation online and in communication with several county residents, and we appreciate your feedback. I want to pick those conversations back up right off the bat here, and I just want to reiterate that the information that we're providing in these updates is just information pertaining to what we are seeing here at Stevens County Hospital and in our clinics. Our intention is just to inform the public as to what we're seeing in our facilities. We're not reporting on regional data. If you want to see that information, please go to the Department of Public Health website. Their updates are published at noon and 7 p.m. daily. The website is dph.georgia.gov. Here at Stevens County Hospital, as of today, we have tested 13 patients. We still have no positive results. We have 9 results that are pending, and we're hoping to get some of those back today. The labs are telling us turnaround time is upwards of 6 days, and we are certainly seeing that in the turnaround time it's taking us to get results back. We have 4 negative results at this time. Hospital updates. All patient entrance to the hospital is now through the emergency department. We understand that that's created some concern, but I want to reassure you, we have sectioned off the emergency department so that there is a side where patients who are coming in for the emergency department are directed immediately upon entrance, and there's another side for patients who are utilizing other areas of the hospital, like our outpatient services, where they're not interacting with people coming in for emergency department services. So I just wanted to reassure everyone of that. Right now, it's the best decision for us to allocate all of our resources and make sure that everyone that's coming into our facility is screened appropriately. We appreciate your understanding of this and of any other changes that we've made to prepare for COVID-19. The only visitors allowed to the hospital at this time are for patients in our labor and delivery department, for patients who are admitted to our facility and are under the age of 18, and for patients who need to have end-of-life discussions. We appreciate your understanding of this. Our nursing staff is working to communicate with family members on their loved ones that are here in the hospital so that you can get regular updates from our clinical staff as to what is going on with the treatment of your patients, but we have to be cognizant of the fact that that we want to ensure that everyone that's coming into our facility is not bringing in anything from the outside. So we are limiting visitation at this time. Again, we appreciate your understanding, and we are working very vigorously to ensure that we communicate with family members. The same stipulations apply with the Clary and Wilkinson centers, our personal care homes that we released at the end of last week. We have restricted all visitation to those centers. There is no visitation allowed. We are working to set up video communication tools for our residents so that they can talk with their loved ones. I mentioned earlier, I know that a lot of concern is rising about the turnaround time for test results regarding COVID-19, and if you've been tested in our facilities. There are still very few resources throughout the nation in terms of who's testing for the virus. For us, it is only the state and a few commercial labs like LabCorp and Quest, and they're just being inundated at this time, so I apologize for delays in getting test results back. It's something that we're monitoring extremely closely, and we'll update anyone that we have tested as soon as we have test results. We are collaborating with all of our regional hospitals to inventory the availability of resources to combat COVID-19, and that involves us talking with all of our other surrounding hospitals and making sure that everyone's aware of how many masks we have, how many gowns we have, gloves, available beds, ventilators, and anything else that we might need in association with COVID-19, so that if one hospital has something that another might need, then we can shift resources quickly to help all of our area healthcare facilities. This is truly a collaborative effort, and we appreciate all of our regional healthcare partners' collaboration in that effort. We are working this week to set up telehealth services from some of our clinics. We'll give you more information as that unfolds. We understand there's a lot of anxiety and apprehension about visiting a medical facility right now. You're not sure who you're going to be interacting with, and we want to be cognizant of that, and also cognizant of those who have elected to stay at home and follow guidelines for social distancing. So we are working to give some tools so that you can still access our clinics remotely, but we will give you more information as we progress in that development. I want to give special thanks to the support that we've received from both state and federal legislators in allocating resources to healthcare facilities, ours included, to help combat COVID-19. There is a concerted effort to make sure that we have the resources that we need, and we are truly thankful to the support of our lawmakers. And that is all for our update today. I wanted to give a quick thank you to some community members that have donated some handmade masks for us. We really appreciate that. Right now we do have a supply of masks available, but if we begin to get low on our supply, and we are working around the clock to ensure we have supplies, we do appreciate you reaching out with those very nice gestures to help us make sure that we have enough personal protective equipment for our medical staff. We will begin posting tomorrow, and I look forward to talking with you then. Thank you very much.